All right, good evening, everyone. Thank you so much for being here tonight and joining us for our November education series, Beyond Metro Denver, Homelessness Across Colorado. My name is Aubrey Wild. I'm the Advocacy Program Director, and I'm stepping in for Alexis tonight. And I'm really excited because we're going to be able to talk about something we don't talk about as much, which is homelessness outside of our little Front Range bubble. The majority of individuals experiencing homelessness are located kind of in this seven county metro area, and so most of the services are located here. But there are a lot of people who are on the edge of homelessness or experiencing homelessness outside of this metro area, and so we are focusing on cities like Colorado Springs and Pueblo tonight, small towns, rural, and even frontier areas throughout the state. And we know that the raw data also don't tell the complete story. So we're going to hear from a really great group of expert panelists about how the experience of homelessness differs in these areas and what services are like and how those can improve. But first, I will give some background about our structure for tonight. So a little housekeeping. Zoom captioning is available if you look at the bottom of your screen. One of those icons can help you activate that. In terms of agenda, we're going to have a brief data presentation and then a panel with some pre-planned questions. Then we'll open it up to audience questions. Note that cameras and microphones are off, so please take the opportunity to connect with folks in the chat. And if you have questions that you'd like to ask of the panelists, please use the Q&A function. That helps us kind of differentiate between getting to know each other and what we'd like to raise for questions to panelists. And this session is being recorded and slides will be sent out after. So don't worry about taking furious notes about all the good things that you're going to be learning tonight. And please do engage with us on social media. You can use the hashtag CCHEdSeries, and you can also connect with CCH and all of our panelist organizations on Facebook, Instagram, X, LinkedIn, and more. And those you can use those tags down below. So now I will go ahead and turn it over to Andrew West, our Policy Associate Extraordinaire, for a short data presentation.
Thank you so much, Aubrey, for getting us kicked off tonight. Hello, everyone. As Aubrey said, my name is Andrew West. I'm the Policy Associate here with the Coalition for the Homeless. And I'm going to give a bit of background data points overview to help make sure we're all on the same page as we head into our panel a bit later. As Aubrey mentioned, the idea is to focus on how other areas are covered outside of Denver, as we know a lot of time resources are spent talking about the Metro Denver region. And although that there are the majority of people experiencing homelessness in Denver, there are thousands of others experiencing homelessness throughout the state. So we want to give that a bit of extra focus tonight and hear about unique issues outside of the Front Range. I'll give an overview of some statewide homelessness numbers, recognizing again that the data is not perfect here, and there are different numbers that we look at to get a picture of homelessness throughout the state. One number that we often look at is the point in time count, which is an annual count on one night, typically in January. That is an unduplicated count of individuals and families who meet the federal definition of homelessness. And 2023 revealed about 14,439 people throughout the state who are experiencing homelessness. We can look at some other numbers, which gives us a sense that this is most likely an underestimate. We know due to data methodology that's reported through the count that it is an underestimate, but we also have some other pictures that really show this as well. About 75,000 people accessed HMIS, which is the Homelessness Management Information System, between the year period spanning from July 2022 to June 2023. And those are unique individuals who access services throughout the period of a year. We also know that in 2022, there were about 134,000 people who were in the Medicaid system and affiliated with a status that was considered unstable housing. So most of those people are experiencing literal homelessness and would be included in a lot of these definitions as well, but are not counted. We've also got data from the McKinney-Vento count, which estimates about 18,000 students alone, K through 12 age students who are experiencing homelessness, doubled up, or unstably housed. That was from the 2021-2022 school year. And for those of you who don't know, the McKinney-Vento is a piece of federal legislation that provides funding and programming for homelessness for students in particular. So we can take all of these estimates and figure that the number is most likely somewhere in between, but this gives you a rough idea of the picture that we're talking about. Next slide, please. I'll look at some year-over-year changes, and I'll again note that it can be difficult to draw comparisons between different points in time because of sometimes changing methodology, different different localized factors for each year for the point in time count. For example, weather is a big one that influences the point in time count. Because that happens in January, the weather can fluctuate a lot, and that can influence how the count is conducted. So I will advise some caution in taking too much from these data points year over year, but I do want to give a picture. Overall homelessness in Colorado increased by about 40% between 2022 and 2023. This was the fourth largest percentage increase of any state, behind New York, New Mexico, and New Hampshire were the three. Over the last 10 years, we've seen real large increases in chronic homelessness throughout the state. Looking at the point in time count, that is about 150% increase. Again, there have been some changes in definition and how those counts are administered, but large increases, and that matches what we've heard from a lot of service providers as well. Colorado had about a 69% increase in family homelessness, and that's defined as households with both a child and an adult, and that increased pretty significantly from 2,100 in 2022 to 3,600 in 2023. This is actually the most significant statewide increase of any state in the country. And we know that fundamentally, homelessness is a housing crisis, and this is really directly tied to the lack of available and affordable housing throughout the country. We know Colorado is the 8th least affordable state, where there are 27 available and affordable homes per extremely low income renters. Extremely low income renters are defined as 30% or under of area median income. So we know that this is all felt by people with the lowest incomes, especially. I'll give a bit of an overview of the continuum of care structure. And again, we have a lot of experts who can speak more to this. The four continuums of care throughout the state are the Metro Denver Homelessness Initiative that administers the Metro Denver Continuum of Care, and that covers Adams, Arapahoe, Boulder, Broomfield, Aurora, Denver, Douglas, and Jefferson counties. Northern Colorado covers Larimer and Weld counties. Pikes Peak focuses on El Paso County, and the balance of state region includes 54 non-metro and rural counties. There is some fluctuation in which counties participate each year, but it does include all of the counties outside of those covered by the other three continuums of care. And I'll mention as well that the continuums of care administer the point in time count, which again does that unduplicated count each year and captures information about demographic statistics, disabling conditions, subpopulations, and other things. I think this is helpful in getting a sense of what Colorado, where we are as a state, getting the breakdown of which counties are classified as urban. So you can see in the middle, large concentration of urban counties along the Front Range, which counties are designated as rural and which are frontier. So the majority of Colorado's counties are actually rural or frontier counties. And again, our Ed series is not necessarily focusing on the divide between urban and rural areas, but really about concentrating on the rest of the state that is outside the Metro Denver region, which gets so much attention. And this is from the Colorado Rural Health Center. It's a great piece of great resource. Again, in 2023, the majority of people experiencing homelessness did so in the Metro Denver region. That's about 70% that is counted in Denver, not accounting for difficulties, especially with the point in time count in different regions. A lot of times it can be easier to conduct this count in Metro Denver because of some of the unique challenges that other counties face. But overall, there were about, like I said, 14,000 people experiencing homelessness. 10,000 roughly are in the Metro Denver region. Northern Colorado recorded almost 900 individuals, while Pikes Peak Continuum of Care in El Paso County recorded about 1,300 individuals, and the balance of state had 2,200 individuals experiencing homelessness. Here is a further breakdown of some of the subpopulations as described in that point in time count. Again, we will be sharing all these slides out. Please do not take notes on any of this. This is also all referenced in our State of Homelessness report that was released early in 2024 with all the data from 2023. So we will also be releasing a report with full comprehensive 24 data once that is available. So definitely check out that report if you have not yet, and we'll be happy to share that along after. So a bit of an overview. I'll give an overview of a couple areas outside of the Denver metro region where we've got some experts to dive in a bit more later. But in Colorado Springs, in 2023, the population was about 488,000. And the Pikes Peak Continuum of Care, which covers Colorado Springs, recorded 1,146 people in Colorado Springs in 2024. About 259, or roughly a quarter of individuals, were experiencing homelessness unsheltered. So that's in a place that is not fit for human habitation is the definition, but it looks like streets, parks, or other areas that are outside of a traditional shelter. The median household income is roughly $79,000, and the fair market rent for a two-bedroom unit was $1,778. The fair market rent is a data point that is regularly published by the U.S. Department of Housing and Urban Development that represents the cost to rent a moderately priced unit in a local housing market. So it's a good indicator of price. In Grand Junction, there were about 69,000 people in total population in 2023. They've recorded 515 people experiencing homelessness in 2021, of which 311 were unsheltered. The median household income in the region is about 68,000, and the fair market rent covers a few different zip codes. So I covered the entire range there from about 1,200 to 1,700. Data for Pueblo as well. The population of people is about 111,000, with recorded 204 people experiencing homelessness in the most recent count. Of those, 34 or 17% were unsheltered. The median household income in the region is about $52,794, and the fair market rent for a two-bedroom unit is $1,258 monthly, of course. And then some data for Alamosa. The 2023 population was just under 10,000. The 2021 point in time count shows only 17 people who are experiencing homelessness. Again, we've got some issues with data there. I found a separate report, a news article from the Alamosa Citizen that reports it's actually much closer to 100 individuals. And the median household income in the region is about $50,000, where the fair market rent for a two-bedroom is $972. So a bit of a data overview to give you a sense of the different kind of areas that we're talking about. I'll highlight some unique considerations for a few of these regions. There can be less shelter access in rural communities. So there can be people who are doubling up. That means they might be staying with a friend or family member and aren't counted as experiencing literal homelessness, right? So while they are housing unstable and don't have a place of their own that they rent or own, they are still housing unstable and could be experiencing homelessness. Also, we see a lot of people that might be sleeping in vehicles. I'll highlight different types of outreach and service providers. So there can be a different network of organizations coming together to work on the homelessness issue. Again, there are not to say that there are not nonprofits, churches, law enforcement, community centers, libraries, health centers, etc., working in the Metro Denver region, just that the composition of players working to get people housed might look a little bit different in different regions. There can also be challenges with housing stock and options that are exacerbated by high costs. So it might be harder to build housing in some regions. And certain housing stock might be older, less safe, less accessible. Again, that's a wide generalization, but this is a possible consideration to keep in mind. And then what works? Collaboration between local organizations to identify challenges and what services must be provided to address the unique challenges and considerations for each region. as well as targeted solutions that focus on the needs of specific populations with the greatest need. This is something the coalition really advocates for, to dedicating resources, especially public resources, to those who need it the most. We know those are lower income households who are more likely to face housing instability and homelessness. Supporting these organizations and services that work in community, that work with folks, and balancing state level standards with local level flexibility. So there are obviously benefits to each, and we want to make sure that we strike that balance well in providing solutions. So that is all I will cover for a bit of an overview to get us all on the same page, and I can turn it back to Aubrey to introduce our panel tonight.
Thank you so much, Andrew. And I'm excited to introduce our panelists tonight who are going to build on this data presentation and complete the picture of what homelessness outside of the Denver metro area looks like. So our panelists tonight include Lance Cheslock. He's the executive director of La Puente Home in Alamosa, and we've been advocacy partners in the past. Jerry Erickson, the Balance of State Continuum of Care, or COC, program manager with the Colorado Department of Local Affairs. We have Crystal Carr, Homelessness Prevention and Response Coordinator with Colorado Springs, and Tia Miller, Vice President of Specialty Services at Health Solutions for Pueblo, Huerfano, and Los Animas County, and Pueblo Regional COC Coordinator. Welcome, panelists. And I'm going to start with a question to everybody. I'd love to hear from everyone here. Now that you've seen this data presentation, is there anything else? Is there anything that surprised you, or anything else you think is missing in terms of the big picture of homelessness outside of Denver Metro? Lance, I'll start with you.
Okay. Yeah. Well, everyone knows that point in time counts are sort of the standard bear for looking at numbers, and Alex, you did a great presentation there using that data and information. Our area, a 6-county area, which is, you add the square mileage up, it's larger than the state of Massachusetts. We do one intensive point in time count every 5 years because we have to resource that. Our number in our area comes out to be between 125 and 200 individuals, which makes our rate basically 10 times more per capita than Denver. I want to point out in the 2021 a year of 17 people in Alamosa. At that point, we had 220 people in Alamosa, but the point in time count only allowed shelter counts, and shelters were at that point were practicing social distancing, and 17 was the maximum amount that the public health would allow. So of course, there are a lot of issues around counts and things. One of the things I want to point out with rural areas also is that numbers in rural areas vary from rural area to another. Grand Junction, the number they came up with, just in the one you said there, they were at 0.9% of their population was homeless. Colorado Springs was at 0.2%. We're currently today sitting at 1.2%. So that's in percentages. I like to tell the story that way because it gives proportion to what people like. But highway corridors like 25 and 70, towns in those corridors usually have way higher numbers than those that are like off in the distance if you're kind of looking at the rural side of things. So the other thing that I think we all get vexed by is every year the parameters of what is considered homeless in a community changes. Some years it's the shelter only. Some in 2015 they allowed folks in substandard housing, which they defined by didn't have running water or electricity. And we had 200 houses that year because that's one way that people survive in the flats where we're at. And so know that those numbers fluctuate and that we all probably have more need than we know what to deal with.
Add to that as well. Lance, that was very helpful and I think reflective of the balance of state in general. And like Andrew said, we know that the pit is an undercounting of folks. And I think also highlighting that survivors are often undercounted in a lot of our various ways of counting folks. Just given that the safeguards around confidentiality and safety that are in place for those who are fleeing domestic violence. So that's another area that's historically undercounted. And I think in general too, any point in time data is not going to be as accurate as longitudinal or long-term data. So at the state, like working with other state agencies and the COCs, various community partners to improve data that we're capturing in our homeless management information system is critical so that we can build up that longitudinal data. And I think the last thing I want to point out is while the presentation did paint a picture of homelessness in Colorado and touched on what was effective, we do know what is effective in resolving homelessness. So in 2023, for example, Partners Across Colorado helped more than 8,800 people move into housing and resolve their homelessness. And for those who moved into supportive housing, this is just from the Division of Housing Funded Services, 94% of those stayed housed. So we know what works, and we know that all of those services and programs are critically underfunded. Because during that same time period, again in 2023, over 9,100 people fell into homelessness for the first time. So that's 300 people higher than we got out of homelessness. So while there are many good people doing great work getting people out of homelessness, there is still a deep need for additional funding and resources to keep up that good work.
I just want to add, I agree with everything that you both said already. And to extend, like, you can't end homelessness without stopping the inflow. It's one thing to lift people up out of homelessness and then to also stop the inflow. And I think in smaller rural counties, there's just less resources for prevention. Pueblo County is not even that small, but we have very, very minimal prevention programs. We don't have a lot of things to prevent someone entering into homelessness. So that's very problematic for us. I also want to add that I think Lance was saying this. He, of course, has a much larger county, but even in Pueblo County, it's actually a very large geographical area, and it's hard to go into those smaller communities and get an accurate count. So there, we all know that's an undercount.
I had another point just in general. One thing I feel that the state is behind on is, we view our numbers as a closed system. Like how many homeless we have in our state is a direct correlation to our housing problems, our social problems and things. But in truth, we live in an open system where human migration and homeless migration is increasing. And so with the Supreme Court law that happened in June, where they're closing down, municipalities and places are going to be allowed to make it illegal to camp in public places. The state of Florida at the national conference, they were just saying, hey, starting this fall, we're going to be arresting people who are sleeping in open places, in public places. This is going to give an increase in human migration. And homeless migration, because you're going to want to go to the welcoming city, like refugees went to Denver because it was a welcoming city, and then all of a sudden they were inundated. So we're going to see, I think some of our data is going to need to begin to take into account that we're the open part of our system. And if I could wave a magic wand, we would be tracking the last place of a person's residential stability. So we could understand who is in our midst that we're working with that are caused by some of our own housing and social issues here, and what are causes of the migration effect. Not that I wouldn't want to serve everybody, but I think it would understand our state dynamics and community dynamics more.
Those are excellent observations. Crystal, would you like to add?
Feel like everybody else has already responded brilliantly. And so, no, I think that it is really difficult. I'm a small town girl originally, and there is this idea that it doesn't happen in small towns. And I know where I grew up, the churches had a pot of money they put together, and ISO not lovingly call it the get them out of town fund. Rather than actually helping them, they'll be like, okay, here's enough money to get you to the next city. And so that was also devastating.
Thank you for sharing that. Jerry, I'd like to go to you to dig a little bit more into your work. You're managing the balance of state continuum of care for DOLA, which means you're managing, coordinating services and data for 54 counties across 10 subregions. So can you tell us a little bit more about that work and how you work with local organizations and communities to assist people in these areas?
So in general, our role as the lead agency, we, with the HUD COC program, we are really just trying to improve our homeless response system across the balance of state with the ultimate goal of ending homelessness. So some pretty hefty goals there. What this actually looks like in practice is supporting our local region. So you mentioned that there's 10 subregions, and even within those subregions, each community is different. They all have different unique political environments, different resources, different folks at the table. So working individually with those regions, hopefully from cross-sector organizations, to support their work in improving their homeless response system is critical. So that includes coordinated entry, of course. So really developing those systems so that we can have an accurate picture of what homelessness is looking like in each of those communities. And then matching them with the appropriate resource, and of course, with the ultimate goal of permanent housing for all of those individuals. Another part of our role is to support our governing board, which is a group of volunteers who make a lot of decisions for the balance of state in our governing body. And we also have a handful of committees. Both of those groups are made up of folks from across the balance of state. And our committees are particularly important because they are essentially where a lot of the work happens. So we have 6 committees, including coordinated entry, data performance, lived experience advisory group, among others. And that is where a lot of the day-to-day work is happening to try to improve our systems the best we can. As a lead agency, we're also responsible for the annual HUD funding competition. If you've ever heard the acronym NOFO, Notice of Funding Opportunity, we provide technical assistance to organizations who are interested in applying for homeless services from HUD, homeless services funding from HUD, excuse me. And so we submit those applications on their behalf, trying to bring more funding into the state to address homelessness. And then, of course, I have to talk about our Homeless Management Information System, or HMIS. We do have a dedicated team for our HMIS system, and utilization of HMIS allows us to better understand the state of homelessness throughout Colorado. And while the PIT is important and required, we've talked about some of the flaws of the PIT count. We know we are not capturing everybody. So having a robust system where data is input, and more importantly, where we can access that data, look at dashboards, see real-time information about who's homeless, what programs they're accessing, and what their housing outcomes are is really critical. And in general, the state, the Division of Housing is excited and honored to be in this role to implement what HUD funds us to do, and to capitalize on state capacity to help coordinate state resources and information wherever we can. So for example, we are looking into how we can better share our HMIS information so that we don't only have to rely on PIT numbers and really just be able to paint a better picture of homelessness throughout the balance of the state.
You've got a full plate over there, Adola. Thank you for doing all you do to coordinate all of these services. Can you also talk a little bit about the Balance of State's approach to ending youth homelessness across the state?
Yeah, thank you for asking. We were lucky enough in 2023 to be selected for the Youth Homelessness Demonstration Program, YHDP, and that is an effort to address youth homelessness, which thankfully is anybody under 25, so it's not minors only. Any young adult under the age of 25 or anybody under 18 who is homeless or at risk of being homeless. And so there are a few different components to that. There are program funds, so those are for nonprofits working directly with young people to get them into permanent housing. And there are also systems improvement funds with that. So we are working to improve our youth coordinated entry system so that we can do what we're doing with the adult population and really try to identify what young people are experiencing homelessness, match them to the appropriate resource, and track their housing outcomes. So that's going to be a huge effort over the next handful of years. We are in the beginning stages of that. It is a pretty massive project, but I'm very excited to see what comes of those funds being invested into the balance of state to really support our young people. And one beautiful part about that program in particular is HUD really emphasizes very importantly that young people need to be at the table for that. We can't be just making decisions from our adult experience and deciding what is best for them and telling them what to do. But there's a continuous feedback loop with the Youth Action Board so that we are consistently modifying programs as needed so that they are youth friendly, they are approachable, and that they are trauma informed for those young people who are experiencing homelessness or who are housing unstable. So very excited about that. Denver Metro also got a YHDP grant, so hopefully more and more funding will come into the state more broadly.
We look forward to following that.
Thanks.
Tia, I would love to turn to you now. What are some of the unique considerations for folks experiencing homelessness in the Pueblo area? And can you tell us a little bit more about your work?
Sure. So I'll start by sharing some about my work and what I do, and then I'll speak to Pueblo and how we try to work together as a collaboration here in Pueblo County. I work at a community mental health center, so it may be unique that my role is not a direct housing provider. I am not somebody that works in a shelter or those types of traditional programs that typically address individuals who are experiencing homelessness. I personally feel, and my employer supports me, in that housing is healthcare. So the work I do is specifically addressing like that need for those individuals that may be experiencing homelessness and have some kind of medical or behavioral health diagnosis. So we take that very seriously in our area, and Health Solutions has created a space for housing within our agency, which I know is somewhat unique, but it's also the model that's going across the state because we took some tours of different places in the metro area to model those types of housing within Pueblo. And my role as at Health Solutions really has nothing to do with housing. So most of my work is voluntary and time that I take away from my typical job. But it's just because I'm very passionate about the work and feel strongly that housing is actually a human right. Everyone should have access to safe and stable housing. There should be no reason why they don't. And so that's why I do what I do. Pueblo is, I think, very unique because we are a larger town. We're not as small as some of our other rural neighbors, but we come across as very rural in some of the access to services or our needs in our community. We have a very low area median income, so there's a lot of poverty in our area and very, very little access to safe and affordable housing. The most recent numbers that I looked at is the vacancy rate for housing in Pueblo County is anywhere from 1% to 2%. So that's over all types of housing, let alone affordable housing. So access to affordable housing for individuals in our community is very challenging. The data Andrew showed was eye-opening, I think, because it shows our lower income, but our rent for a 2-bedroom is not that different from other communities. So our rents are not, matching up to our low income standards that we have here in Pueblo. So my role through really the volunteer work, because it's not part of my job duties in the regional COC coordinator work, is it's not a one-person solution. Not one person in any community is going to solve and end homelessness. It can't happen. You have to have the entire continuum of your community together to address the need, because the need is just too large for one person. And so my goal and my hope is that we bring partners from all different spectrums of the community. I hope to represent those in the medical field, so that's my function, but we bring people in who are part of our shelter organizations, our housing departments. We want to partner in with even our law enforcement, any of our nonprofits, church organizations, and the community as a whole can come together and to lift people up, because the solutions is not easy. It's just not easy. So I think that's unique to Pueblo. I'm not born and raised in Pueblo. I'm a transplant. I've been here 20 years, but if you're familiar with Pueblo, I am still not a local. 20 years does not mean I'm part of the community in some ways. But I feel very strongly about my community, and I think that oh gosh, I forgot where I was going with this, but basically, I feel that there's like kind of like a small town feel in a bigger city. Like we have a very small town feel where people know each other, and we may have small community organizations, the very small capacity in some of our nonprofits. And so we have to work together, and each person brings a unique piece of the puzzle to the larger picture. And so one small nonprofit over here, or one person at Hustlish, because I'm one person, we each can come together and create a puzzle that will end homelessness.
Yeah, it sounds like collaboration between organizations and communities and individuals is really a theme that's emerging here tonight. Thanks for highlighting that. Crystal, I'd like to turn to you now. What do you do as a municipality to combat homelessness, and how do you work with local nonprofit organizations to address the issue?
So it's really interesting because one of the things is that every municipality has a different funding source, and so how you get funds into the community, what you have prioritized to get funds flexed into, all changes. And so the city of Colorado Springs is not a service provider. That's something that the mayor is constantly saying, that we're not a service provider. We do have street outreach workers through our homeless outreach program through the fire department, and they're fabulous. They go out every day doing outreach, and they focus a lot on the downtown area and people with extra needs. One of the things in our community that is really difficult is that people who cannot do their activities of daily living independently rarely are able to have shelter. And so that means our most vulnerable people are left to be outside. And so they work really hard to go out and engage with those individuals and try and get them into appropriate placement. So that's like, the reality is, most, other than our HOP program, most of the city's work is around funding, collaborating, trying to engage that private public, that community. Like Tia couldn't have said it better. That's where it has to be. And so a lot of my work is getting engaged with different organizations, different nonprofits, managing some of those ESG funds, which are really small in our community. And the city does provide approximately $500,000 a year out of the general fund to assist with shelter and to try and encourage shelters to lower barriers, to make it so that everybody can really get it and address those challenges. So it's a lot of collaborating, a lot of funding. The mayor Mobilade often talks about trying to come to this with a balance of compassion and public safety. And so that's kind of the thing. But we just released our 2025 to 2030 homelessness response action plan this afternoon. And so I'm sure it's on the website if you're interested more, but that really detailed it. But it's basically funding, collaboration. We do have our street outreach program. There is enforcement and cleanup. We were sued a while back, I think actually from the county of Pueblo, due to our water issues. And so that kind of emphasized a little bit the need to make sure that environment and water is clean. And then, it's about, and one of the things, my favorite things that I get to do is we have a small program called Work COS that we're actually able to employ people who are currently living either in transitional housing or at one of the shelters in town, to hopefully help them get stability. And the people who run that program, they're incredible and do a lot more than what just a normal employer does. So it is a very supportive environment. And kind of the goal in there is trying to help people find what they're good at and help them to really reestablish themselves and get them on the way. Sorry, that was roundabout.
That was fantastic and lucky timing for us. We'll be sure to take a look at that plan and send that out in our recap of this evening for folks. Lance, La Puente has been working in the San Luis Valley for well over 40 years now. So can you tell us a little bit about how you serve the community and how that shifted and how your work is unique to your geographic region?
Yes, so the initiative started back in 1981. I've looked through some newspapers and there's still some very things that are being said today that were said back then in terms of attitudes and things. And so we've always spent a lot of time on like educating our community, trying to build understanding within our community, and then trying to build partnerships to to address emergent needs and programs. So, our shelter started back in 1981. And had been running around 900 to 1,000 new intakes a year. When prevention work came along, and we're still doing prevention work to this day, we saw those numbers go in half. So that was our testimony that, boy, prevention really does work. And we have a closed system, more of a closed system, so we were able to measure that. We started, of course, with transitional housing and led to supportive housing, a much better model, and have 27 units. And have had a lot of partners in that, people who have donated houses, people that have constructed things. DOLA has been amazing with helping us with grants. So we've been able to build that particular stock up. We have a family resource center, which does home visiting to roughly 200 families a year that are inviting us into their homes to work with some stable resourcing and stabilizing services as a prevention measure. We've also, just because poverty begets homelessness, when you're in a poor community and you have these higher numbers, the resources that are right in our own backyard are really hard. But in starting, we found that we have started 3 thrift stores, a boutique, and a coffee shop, and those Main Street businesses have won the hearts of like some of our other civic folks, our downtown folks, so they show up. And part of that effort led to the starting of a Alamosa Homeless Coalition, and so which has the business sector and other sectors in it. And so we, people working together, you always build those bridges of understanding and can have more partnerships. We're really proud of that. And with a small community too, like I'm having coffee with the chief of police next week, and we don't even know what we're going to talk about yet. We're just going to be getting together. And the editor of our one newspaper is coming to our Thanksgiving dinner and is going to, do some things. Alamosa also, I'm really proud of them that they took initiative and they bought a 2-acre parcel of land where they let people camp that might be getting evicted off of property. And so, we work to support that campsite. In a small community like ours, you're not competing with other programs because there's not enough money for 2 programs to exist, and you're working together, and that's really nice. And and our numbers are low enough that we can know individuals and connect with them. And I think there's more of an intimacy. I don't know a better word, just like a closeness that we can get with folks, both landlords who may have had a bad experience and help them to get things back the way they need to be. So I feel like we're in the best of small communities for having an impact. I don't know whether I'm of a believer where homelessness will go away, because I feel it's more of a symptom versus the problem, and that we have to deal with symptoms and things. But certainly, affordable housing is tight around us. The city just built 20 little tiny homes for folks, so there's another example of partnership. I also, in terms of being able to tell our story, I would say that every rural community really is very unique in their own stories. And I love what you're doing here to give folks an opportunity to hear and understand what's going on, and want to make sure everybody gets invited. So, come to Alamosa. Lunch is at noon and dinner's at 6. I'll treat.
I love it, Lance. Thanks. What a testament to the power of relationships in this work. Crystal, I'd like to pop back to you for a moment and touch on something that you mentioned around cleanups as part of the budget and the effort around homelessness. Back in September, our education series was on criminalization and homelessness. So we learned a lot about municipal codes and enforcement and how that really differs greatly by jurisdiction. And we know that Colorado Springs has really been touted as a national model for homelessness resolution lately. And some of those efforts have centered on sweeps or forced removals, cleanups, whatever you prefer to call them. So, can you just talk a little bit more about how those fit in with the greater strategy? And then, if other panelists also want to talk about that topic, I invite you to jump in as well.
So that's a complex issue, right? And so what Colorado Springs is trying to do is balance the need of, keeping the environment safe, clean, and also having people feel safe when they're out and about. And that includes people experiencing homelessness. And also trying to go out and meet people and give them dignity and respect and embrace them with compassion. And so, that's one of the great things that the HOP team does with the fire department. And I'm really excited. We have a new chief of our department, and our department was recently renamed to Housing and Homelessness Response. And she has this great vision for really bringing kind of it together so that we're not, pushing people out and then coming along and trying to offer them resources. One of the things we started doing this year is that when we know that, there's going to be a cleanup, go out to a certain area of town. The week before, our HOT team, our homeless outreach team through the fire department, sends an email to all of the agencies and saying, look, this is where we're going to go. And we'll try and get ahead of it so that we can get street outreach providers out there before the sweep comes in to try and engage them and get them to services. And so it really is trying to do that compassion along with keeping the streets clean. And, it's difficult and very complex, but that's kind of what we're trying to do is can get that information out there so that maybe they can be gone before, the cleanups come and to at least save people from being arrested and get them resourced to hopefully identify what they need and help them get what they need.
I'll add a little bit here. Sweeps have definitely come up in multiple regions throughout the balance of state, unfortunately. So, for example, in Grand Junction, there was a regulation passed that made the use of tents during the daytime illegal, and that was citing health and safety concerns. And there was a really large park where a lot of unhoused folks were sleeping. So as a result, community members, different service providers came together and opened the Homeward Bound Resource Center, which was pretty quickly established. And the Resource Center is a safe and warm place for people to stay during the day. It's also a great place to access resources around housing, healthcare, basic needs, anything that someone might need. And kind of similarly in Montrose, City Council passed a camping ban, and in the wake of that, homeless service providers and advocates have come together monthly to discuss strategies around ending homelessness. So while codes and sweeps definitely present additional challenges around addressing homelessness, we have seen communities really coming together in the wake of those decisions to collaborate on solutions and strategies. So try to look at that silver lining a little bit. And I also just want to say that, as the state and as the Balanced State COC, we are here to support communities as they work through how to respond to unsheltered homelessness that they're seeing in their communities. So we have seen in Colorado, as well as other parts of the country, that sweeps actually create a cycle of homelessness that can lengthen the time that it takes to resolve that instance of homelessness. So if anybody's interested, we are happy to connect with community partners to think through what could be effective tools from your toolbox, your unique toolbox, because we do know it is a real concern and a real challenge, and it's not an easy resolution. And one thing that we do know that works across the board is making sure that we are able to identify throughout the community who is experiencing homelessness, what their name is, creating that by name list of folks who are experiencing homelessness, and then really working methodically together with various partners to get folks into housing. So Fremont County and I believe Douglas County was able to be successful in accomplishing that with the vet homelessness. So identifying every veteran experiencing homelessness and getting them into housing successfully. So it is doable, although it is challenging and daunting.
Thank you for taking on that tricky question. I know it's a challenge. So this is a question for anyone who is interested in answering. We've talked a lot about the unique work and climate in each of your regions and across the state. I'm curious to hear what you think of how those of us in the sector can work better together and learn from each other and share best practices. And if there are any current collaborations that you'd like to highlight that you think are succeeding, I invite you to do that.
I would love to jump in there. I kind of have two really successful, well, I think successful collaborations. Our COC, the Pikes Peak Continuum of Care, recently started having some really difficult discussions because, you know, we all come to this with some different ideas. We all want to end homelessness. Everybody has their own opinion about what it looks like to do that and how to get that done. And, you know, my personal opinion is there's not a silver bullet out there. There takes multiple solutions because there's a multitude of reasons and ways that people experience homelessness, other than just acknowledging that affordable housing at all income levels, especially those at the lowest income levels, is the base need. But not all of us in Colorado Springs agree on that. But we started having these very difficult, real conversations about what we think about homelessness, what we think we need to do about it. And I feel like that has built some trust so that we can truly start to collaborate and do more together. And rather than trying to, you know, kind of pick each other apart with that, I think Lance mentioned the competition. Somebody else shared it with me, but the idea of the nonprofit Hunger Games, where you collaborate until somebody dangles $1 and then everybody is like out for themselves. And so we're really trying to push against that and create a space where we really respect everybody to get moving so that we can improve the systems and truly do collaboration that is going to change lives.
I would agree with that, all that she said there, Crystal. I think that for me, my why I shared earlier, I think everybody has a right to free or safe and stable housing. Like that's a human right. But that's my why. That may be not what other people in my community feel. They may feel something different or have a different opinion of how to make that happen. And me spending my time to try to convince one of my community partners to agree with me and follow my lead or think my solution is the best really doesn't get us anywhere. It doesn't solve anything. I really should be meeting my community partners from their why, what they feel is what they think is a solution, and meet them there, and we can find some middle ground and we can find a way to solve this together. But if I spend all my time just trying to convince another person to believe the way I believe, I'm wasting my breath. And I forgot how Lance said it earlier, but it's housing is a symptom, right, of other problems. And so being able to have that dialogue with our community partners and solve some of those other things. How do we get housing? How do we get all these other things? How do we prevent homelessness in the first place? Like those kinds of things. Have those dialogues, have those conversations. In Pueblo County, we do have what they call a community commission on housing and homelessness, and this started in 2020. What a year to start a new initiative, right? And so it really provided an opportunity for those dialogues. We spent time around with all community partners across the entire spectrum of our community, and talking about possible solutions. What can each person do? And If our shelter is struggling, which we've had troubles with our shelter being stable in our community, it's not about, oh, look at them, you know, they're not handling it. No, it's like, how can we bring them along? Because if the shelter is successful, our whole community is successful. So that's our dialogue, and that's what we try to accomplish.
I definitely agree with everything Tia was just saying that folding in various providers and interested parties from multiple sectors is really critical because it is going to take systemic change to address homelessness. And there are many parts of that system. Um, Something else that I am excited about is what's happening more on a statewide level. So Colorado does have a statewide HMIS system, and with that, an HMIS statewide collaborative. So all of the HMIS leads come together and are really working to improve that system. And it's a lot of lessons learned have come from that. Excuse me. So now we are bringing together the other side of the COC lead, so the collaborative applicant side, to try to duplicate that and really have time to connect, share trainings, work together on statewide efforts. So I'm really excited about the possibility of Colorado as a whole really working to address our challenges not only with homelessness, but with housing affordability as well. So very curious to kind of see where that goes over the next few years. And I think that the peer support network is really important. As a balance of state, we have a lot of unique challenges. So I will often reach out to other balance of states throughout the country to see if I can learn from them and to share what has worked for us here in Colorado. And I think that can be applied to anybody. So homeless service providers having other peers that they can go to workshop, be a thought partner is really important in this work because it is so taxing, it's challenging, it can be really frustrating. So having a peer and somebody you can really work through things with can be really helpful.
Lance, would you like to jump in?
Yeah. So there was a quote that kind of came out that we've been working with, and it's like if you plant lettuce and the lettuce isn't growing well, you don't blame the lettuce. You look, you maybe add water, or you nurture the soil, you do provide more sunlight, but you don't blame the lettuce. So we kind of brought that concept of what's in the soil around that is keeping some of our homeless from finding services, from thriving, and all the outcomes there where you fall short, and have a team of people that are getting together that are looking like what's in the soil of our community that we can enrich, whether it's unfair laws or other practices, whether it's just that sense of judgment or judgment that people have, whether it's where understanding we have some high barriers to get in some of our mental health services, and that came up. So we're trying to take a perspective that try to improve the soil of our community to have better outcomes in terms of working together. A couple of other proud things that I would say is we had a philanthropy days, which they do in rural communities, and most of the nonprofit organizations, we agreed that we weren't going to talk about ourselves, but we would talk about another program. And so we all were talking about another program, and eventually our programs got talked about. And it was really interesting to watch the funders' approach within all of that to try to lift up. One of the things that came out of that is Catholic Charities of Pueblo, who happened to be visiting. They were part of that conversation. And even though they aren't from our community, their rehire program, which is an employment program that we can't get in our part of the state because of limited grants that they offer. They are establishing a rehire outpost in conjunction with us to bring job-related resources to our homeless population. So I think Pueblo's a pretty cool community if they can reach that far away, 120 miles away, and I'm really, really proud of that. And we're kind of short on volunteers, and we're trying to get food to our homeless camps. And we put the word out, and we have nurses and our AHEC and college students and folks like that are picking days to take cambros of food out to the homeless encampments that are too far to be reached just in terms of our soup kitchen. So small successes, but ones which really help build the spirit.
I love that lettuce analogy. I'm going to borrow that. It's also a really great segue into a conversation about policy and some of those systems that are so entrenched and might help facilitate homelessness prevention or resolution or hinder it. So at CCH, as you all may be aware, we're very active in policy work at the state level. We also dabble in the local level and the federal level, but the meat of what we do is really at the state level. So I'm wondering, what role do you think the state has in preventing and resolving homelessness, especially outside of Metro Denver through policy?
I can jump in here because I think the state has a huge role in that. Um, and I know that the state, specifically the Division of Housing, is really working with COCs, grantees, communities around local efforts. So specifically, there's a few examples we can point to. There's the Making Homeless History Playbook, which lays out some concise key goals, cross-cutting principles, and proven solutions. And the intent there is that since each community is unique and we know it works, each community can use this as like a starting point or to continue whatever momentum they already have in their journey to resolving homelessness in their local community. Additionally, I feel really lucky that Colorado has 34 of our 64 counties are working on Built for Zero, which is an initiative to better have better homelessness data so we can end homelessness across the board. And most of our homeless population are within those 34 counties. So there's a really concerted effort in improving our data quality and having a better understanding of who's experiencing homelessness and how we can better connect them to resources and resolve that homelessness. And then the state is also at the table for most committees, working groups, advisory groups, etc. And if we're not at the table, please invite us. Like, we'd love to join those and either be a formal member, an advisor, or whatever support we can offer. I definitely want to make that available. And in general, I mean, we know that housing and homelessness impacts everybody. So plugging in wherever possible, whether that's local or at the state level, is really critical, especially outside of the Front Range. Knowing what's happening around housing in your community and assessing where you as an individual may have influence or impact, or you as an organization may have influence or impact, because local policy can be just as impactful as statewide policy.
Yeah, Jerry, when just knowing your role with HMIS, like and our conversations about the pit, we have to gather data on so many different platforms. And HMIS back when it started was pretty hard to learn from, but it's getting so good. I mean, if I could wave a magic wand, there would be a modality of HMIS that supplants what we do in a pit count. And the population that gets missed right now in most pit counts is the unengaged unhoused population, because pretty much everybody else that's in services needs to be there. But with the growth in street outreach efforts and things like that, there might be a type of HMIS that can begin partial enrollment or whatever to be able to capture things to keep us from having to burn a whole day and lots of resources to get data that isn't really doing us any good. So that's where I would be at with HMIS. And then I would urge you to embrace the reality that we're in an open system, that Colorado is not a closed system, and that we will learn more about our homeless population if we ask in HMIS, where was the last place of your residential stability? They did that. They did that in the state, and they found that the 11% that was the number of people in rural communities. When they asked that question, they found that there was an additional 6% of the homeless population in that state that were staying in urban shelters that had been displaced from a rural community. We could learn so much by that particular number, and also just understanding the in-migration to the state. Not that that's going to happen, but that just really gives us a dynamic of where we're putting our energies. So I would put that out there. And then the last policy thing that this is something that there needs to be, I think, state leadership on, and I think Colorado Coalition for the Homeless could do this, is I would love to, I'm seeing in rural communities that that people are trying to adopt policies that they see in other rural communities. It's like, what are we going to do? And they're looking to borrow some things. So, thing that came up in Alamosa was, hey, Boulder has criminalized panhandling. Let's make all of our panhandlers have to get a criminal background check and get a permit before they can panhandle. And luckily, we were able to ward that off. But if there could be a template response or a state response that can help us stay ahead of what municipalities might be looking to in terms of the Supreme Court ruling, that allows communities to make it a criminal offense to uh, camp or be or just sleep in a public place. If the state could set a tone or provide some guidance, or maybe even come up with a state policy that stays ahead of that, I think the hardship that we will see in communities that come up with such onerous policies could be partially prevented. There'll be some communities that would push it anyway, but I'd love a statewide think tank that looks for alternatives because there's a lot of things brewing out there. And it'll be a lot harder to undo bad things rather than to prevent those things from happening.
Well put. Crystal, Tia, would you like to add anything?
It's hard to follow Lance. I mean, he's the one that brought up the lettuce comparison. That's so lovely, and I'll probably steal as well. But I don't know that I could add anything. He really shared a lot, and I appreciate what Jerry said as well.
Yep, this has really been such an all-star panel. You all have been so thoughtful. So thank you for sharing with us your thoughts and all about what you do. Final question that I have, and also a reminder to folks who have tuned in tonight, please drop any questions you have in the Q&A so we can get to those before we wrap. But I just want to ask for some advice for folks who might be watching tonight or might be tuning in on YouTube after the fact. There are a lot of people who are just interested community members and who care about the issue of homelessness and want to help. What do you think that they can do to impact change?
I think the first thing that any of us can do is work on getting educated, but also when we encounter people who are living outside or appear to be homeless, treating them like saying hello, treating them with dignity and respect, because the way that they're treated a lot of the time and treated as invisible, it is devastating to the human condition. And so, like, we need to really start recognizing the humanity in one another and honoring that and just doing that. And then the other thing is, I always plug two books that have come out in the last couple of years. Homelessness is a housing issue, and When We Walk By. Both two really good books that I encourage, educate yourself and then get involved. Like in Colorado Springs, we have a homeless union, which is really exciting. And they're amazing humans. And I'm just like, I want everybody to get engaged,
I appreciate that, Crystal, and definitely agree. My first note for this was get involved locally. And our HMIS data does show that overwhelmingly people are homeless in communities that they've long been a part of. And I think there is a misconception that the people who are experiencing homelessness are not their neighbors, but they truly are. And Colorado is such a diverse state with so many different political climates, resources, policies around homelessness. And there are passionate people and organizations in all parts of the state. And I feel really lucky to work with so many of them. So if you aren't plugged in, find those people. I'm happy to help connect if you need that. But there are so many people around the state really doing this work already. So plug in where you can and use your own unique skills. Everyone has different backgrounds, experiences, skills. And so many different things are needed. We don't just need case managers. We need a whole host of folks who are partnering with people who are experiencing homelessness. I think the last thing I'll mention here is understanding and talking about what homelessness looks like, especially in rural communities. Homelessness does not always look like, or often does not look like, people in a tent on in a park or on a sidewalk. It's people living in RVs without utilities or in their vehicle. They're camping on public land, staying in one part of the state during the summer and another during the winter, living in sheds, garages, doubling, tripling up. It's much harder to identify. And so people don't think it's a problem that's in their community. So really understanding that, and like Lance spoke about earlier, really educating folks who have influence. So working with your local elected officials, law enforcement, faith communities, other engaged citizens to really educate on what that homelessness looks like in your community specifically. And I think I'll end on, it's just so important to understand and to share how homelessness is a systemic failure, and working collectively to make housing more available and affordable will require systemic changes. So really being a part of a community working towards those systemic changes is critical.
Lance, Tia, anything else to add?
Everybody said it so well. Tomorrow at 9, my street outreach worker and a city councilwoman are taking a walk to meet and talk to people down by the river. I just feel like educating, boy, if you get people to talk and meet those that are part of our conversation, meet and that's a real game changer.
Excellent. We've got one question in the Q&A. This will be our last question, and then we can do some wrap up. This person asks, how can grassroots mutual aid groups that do outreach in scattered encampments better collaborate with more established organizations to get people into the HMIS system? Great question.
I kind of, based on what Jerry said earlier, contact your local agencies that are doing street outreach and ask them, how can we do this together? All of us that have COCs, reach out to your COC and say, how do we get involved? And it's not necessarily, I don't want to speak for other communities, but it's not necessarily as hard as you think it might be.
I think for us, like some of our smaller communities, especially these grassroots outreach programs, they don't have the capacity or the resources to even have computers or go into HMIS. Or I have somebody I work with very closely in Pueblo, like their printer is broken. And so I will print out a bunch of packets for them so that they don't have, that's not a worry for them. Like that's something that I have. I have those resources. I can make that happen. So whatever you can do, it really takes everybody. I spend times on my weekends or entering in information at HMIS for some of our communities because they don't have those capacity or resources to do that. And it shouldn't be, like I said before, it really has to be collaboration. And if my role, I don't have the resources within my work to go into the encampments every day. I don't have that. But if someone does, I have access to a printer and a computer regularly. So I can print out those packets. I can put them in the computer and you go and meet with the person every day in the encampments. It shouldn't be on one person to do all that work. And I personally, I try to facilitate a coordinated entry in a way that anybody is welcome. And if they have a passion for this work, they're always welcome to come. And if I always, when I introduce the work that we can do in coordinated entry, I give them the range of how they can participate based on their capacity within their role. So they may be able to enter in at all, whatever level that they can. They don't have to be fully engaged and do all the HMIS work. They can come in at whatever level they have the capacity to do.
I really appreciate that, and can't say it better than Tia and Lance. So Matt did put our emails in the chat. So if you are within the bounds of state and want to make that connection, we would love that. So please don't hesitate to reach out.
What great invitations to get engaged. Thank you all so much. We really appreciate all of your insights tonight, and glad we were able to all make these connections. And Andrew, perfect. Thank you. You read my mind. So we are not going to have a traditional education series in December. Typically, we try to pivot to our homeless persons memorial vigil. We would like people to join us there. We do this every year to honor the folks who have passed away while on the streets in the previous year. This year, we are going to gather together at 4 p.m. in front of the Denver City and County building on Saturday, December 21st, to honor those lives. So please do join us. We'd love to see you all there for that special time. And thanks everyone for joining. Keep an eye out in your email for all of those great resources that were mentioned tonight, the recording and the slides, and an invitation to sign up for next month's vigil event. Thanks and have a wonderful evening, everyone.